Dr. Tom Byrd, folks. We're fixing to give you an update, information on this COVID-19 and whatever else comes up.
Sure.
Appreciate you gentlemen being here.
Sure. Yeah.
All right.
Happy to be here.
Huh?
Usually, when I'm here, we're either talking about local basketball or mission trips to Burundi, and so a little different topic today.
All right, I got microphones hooked up. I hope they're watching. I hope they're working. Estella, let me know if you can hear these guys.
Mic check. This
Mic
is Mike.
check.
This is Mike. Mike 1 2.
All right, y'all let me know if y'all can hear.
Tom
Dr.
check.
Byrd
This
and
is Mike. No, wait, that's not it.
Tom check.
Tom check.
Tom.
All right, Sam, Daphne, somebody let me know if y'all can hear.
You actually have people watching this?
Yeah, absolutely. Loud and clear, they said. Good.
Absolutely should have gotten my agent involved in this.
Awesome.
Exactly. Did you contact our agent for this deal?
No, yeah.
Is your agent Scott Boris by any chance?
Sue Byrd?
Sue Byrd is his agent. All right.
No, you know what? I watched the documentary last night on the Doobie Brothers.
Oh yeah.
Their manager is the very first. They've had one manager, one guy for 50 years, and he was their buddy from high school or something.
Really?
Yeah.
Now that's pretty cool.
Yeah, I don't know if any fans
I sat on an airplane with the manager for Rascal Flats, and he.
All right,
did
5
that way
minutes
forever.
after 8 o'clock. Let's check
Yeah.
back in one more time with Chief Meteorologist Randy Turner on our weather.
just can't.
Well, Randy Turner, you know Dr. Tom Byrd, I know. You know Mr. Michael Cloy right over here, I know.
Hey, I think we need to change the segue. Yeah, hey, Randy, you got your Lysol bottle? So we're going to have a duel on the street. With
Well
Lysol.
played.
We can't hear him, though. We have to have headphones on to hear Randy.
You can't, well, yeah. Just read his lips.
I'm trying that.
Okay.
Yeah. I had this idea about the weather. From now on, instead of your professional, we're going to go to Randy Turner. I think you should do it like hee-haw. Hey, Randy, what's the weather?
That's right. Yum, yum.
You know the Lysol duel with the essential absence of sports, that could be on ESPN. If you think
Hey.
about it, Lysol,
Yeah.
Lysol tag or
They're kind of hard up for entertainment. If they're going to show pizza box folding contest, I think a Lysol spraying contest should be in there too, a duel. I think you're absolutely right. Man, we're on Facebook Live, and there are a lot of people watching because they knew you guys were going to be on here this morning. And our
I
good
wanna
friend
help them.
Clem Jenkins is watching this morning from Killeen, Texas.
That's
My
Tom's
old-
old stuff.
my
I know,
stomping
you
grounds.
might know Clem over there, as a matter of fact. Yes,
Clean's grown.
it has. Isn't it crazy over there? Golly.
Six high schools.
Wow. 6. I remember when there was like 1.
That was my graduating class. My graduating class was the last year of one high school.
My goodness. Yeah. Just like, what is it, the other one? Round Rock, too? Kind of the
Oh, yeah.
same way?
Yeah.
Golly.
Blow up.
All right, so we are on KOXE Live. We're also on our Facebook. A lot of people tuning in this morning. A lot of folks saying hi because we're going to share some information about this COVID-19 from Michael Cloy, who's right over there. Now, Michael's in the dark shirt. Dr. Tom Byrd, if you're watching on the video, is wearing the Texas 4000 fighting cancer shirt right there. There we are. So appreciate you gentlemen being here. From XL Health, by the way.
It's our pleasure.
Happy to do it. Happy to do it.
First off, you guys are doing something over there at XL Health. I heard it on Randy's News. You're offering an outside in-car. What is this
Kind
all
of a
about?
drive-up clinic, if you will.
Okay.
The goal is really to not have a waiting room full of ill people, and so we've modeled this. Dr. Byrd actually proposed this, and we've modeled it after some other clinics up in the Northeast, I think.
Okay.
Having people drive in. We're actually doing a shared decision with the patient as well as us. If the patient really wants to come inside and we deem they really need to be inside, we'll bring them indoors. Yesterday I conducted multiple visits via car on some of these patients. Sometimes you just need to talk about things, and so that can be done in a vehicle. Sometimes you got to bring them in.
Yeah,
All right.
we're doing it at all the locations too, in Stephenville and De Leon, and both locations here in Brownwood. So
That's awesome.
Yeah.
Appreciate you guys doing that because these are crazy times, as we know. This social distancing thing. By the way, are we far enough apart? Let me get my cattle prod out. They're over there.
I looked in the corner. I was going, "What is that thing over there?"
That's my social distancing prod. Okay, is what that's all about. All right. So
Well, it's actually, you know, we were a little worried about how it was going to work, how the patients would receive it.
Yeah.
Our staff, I really want to go out there and say how great our staff is set up and how they're working. We can do your vital signs. We can do testing on you in your car. We've drawn blood on people in their car. And so we can do just almost anything that we can do indoors. It certainly depends on what you're there for.
Wow.
But our staff has been humongous in getting this going. All of them, from the front desk to the nurses to administration, has been fantastic, and the providers.
So you're offering these services here as well as Stephenville and De Leon too.
Yeah, 2 locations here in Brownwood, actually.
Two locations.
yeah, there's one at 104 South Park, and then the bigger one at on 377 next to Texas Bank.
All right, gotcha.
Yeah.
All right. Of course, you two gentlemen went to work for XL Health here in the past few months, and I guess otherwise things are hopping out there, busy, I guess. Pretty much.
Yeah, it's an odd time, Carl. I mean, we're trying to canceling people with just their routine yearly checkup. We'll bring them back after this is over, but we're certainly available for folks with chronic diseases that need checkups, and then the work-ins with respiratory disease and things like that.
All right. Well, one of the reasons we're here is to talk about this COVID-19. 3 confirmed cases in Brown County, and more tests, I guess, are still out there waiting
Sure.
for the results to come in as of this morning. So how close do you guys work out here with the health department? What information do you get from them, and what do y'all share with each other?
Oh, daily.
Daily?
Yeah, I talk to Cliff Carnes daily. Also Jennifer Jones, who's the infection control nurse at Brownwood Regional. So yeah, we deal with them absolutely daily. Before we do a test on anyone, and this is true of all the XL clinics, and I think it's probably true of all the private clinics in Brownwood, we consult with the local health department to see if makes sure it meets criteria, because we're blessed. We've got a decent number of test kits, but throughout the country, throughout the world, it's limited. So you have to be really careful on who you test and make sure you're following the CDC criteria. But yeah, we check with them with every case.
I guess we will continue to see more testing, I guess, in the coming days.
I think so. I think, first of all, the testing capabilities were very limited, and I think they're going to grow. Obviously, private sector is going to help us with that, as well as the CDC and government. There's always a lot of regulations that go with any kind of new device or any kind of new procedure or medication or anything like that. And the FDA, in some cases, can be cumbersome, but they're there for the protection of us. And so, we do have to vet these things. There are going to be people out there that are going to be scammed. And so you need to make sure that what you're doing is a approved and a vetted test, if you will. And so I think there are other newer ways, not necessarily new, but older testing methods that have to be configured for this virus. And so those are coming online now. I think more testing will be available. Obviously, with more testing comes more cases. There are probably cases out there right now that haven't been tested. And so that's going to be alarming to some people, but epidemiologically, it's going to be useful to us.
Okay. Now, we want to shoot straight here. Do you guys expect more positive cases?
Yes.
Do you?
We do.
Okay.
I do.
Absolutely.
Okay. We've had 3 so far, and as you said, probably expecting more as more tests. And we still have a lot of the original test information hasn't come back. Now, the testing itself, I understand, sent to Fort Worth. Or what do you know about the actual testing itself, Dr. Byrd?
Yeah, there's a lot of shifting sands right now. I mean, we're utilizing 2 mechanisms and about to utilize a third. With our clinic, we use LabCorp. We do some of the tests that are sent to LabCorp. That takes a few days to get back. Now, our health department has done a fantastic job, and I don't know the ins and outs of the kind of boots on the ground, how they work this out, but they're literally driving the local test to Fort Worth every day, and we're getting those back in anywhere from 24 to 36 hours. Now, what's about to become available, and certainly through our clinic, we have access to a method called PCR, which is a way you check for antibodies that the virus has created, that you've created in your body to the virus. And that'll be a really rapid test. That'll be 45 minutes. We're going to have limited access to them, but we'll have that probably within the next few days.
I've read about that. Yeah,
Yeah.
that 45-minute test. All right, let me ask you this. Who, not specifically name-wise, but who is tested, and how does the test actually work? Can you gentlemen enlighten us on that a little bit?
There are two ways currently to test people. One is what's called a nasal swab or a nasopharyngeal swab. We've used this technology for influenza every single year. And so you'll take a swab of the secretions in someone's nostrils or in their nasal pharynx, which is really way back in the back, and so it's not a comfortable test. But you'll take a swab from those individuals who you deem meet the criteria and who are, in your opinion, at a greater risk for COVID at this point. And then that's sent off, and that test is taking a little time because we don't have. That's not an office-based analysis. In the case of the flu, it is because that's been around for quite a while. And then Dr. Byrd elaborated, the 45-minute test is an antibody test. But I want people to understand what happens when you get a disease like this. Your body starts to mount a defense. And so your immune system, unless you're immunocompromised, begins to make antibodies, things to try to kill whatever it is that's making you sick. And so this rapid test is what's testing for those antibodies.
Okay.
And I think that's done by blood, is that right?
It is.
Yeah.
Okay. So this COVID-19, that's I don't know how many cases now in the U.S. I think 40-something, 50,000.
Actually, last night they're saying we eclipsed 80,000.
80,000, about 1,400 here in Texas. I think we've had 16 deaths so far. Of course, the death rate, if you get this, is still low, obviously. But what does the COVID-19 attack in your body to those who have succumbed to this terrible virus? What does it do actually to the body, Doctor?
Yeah, let me back up a little bit
Sure.
on the number of cases. And I think I don't want to be alarmist here, and I'm going to say this and then walk it back. You know, when Mike and I mentioned that we think we will see more cases before it plateaus, or as the epidemiologists like to say, the curve gets flattened.
Yeah.
I think that'll be coming over the next few weeks and maybe even month. And there's a lot of models out there. I don't think anybody knows exactly when this is going to happen, but I think we're on the way toward that, but it hasn't peaked yet.
Okay.
The numbers are a little bit frightening, but let me kind of explain it. If you look worldwide, from the first case that was identified in Wuhan province, China, to the 100,000th case, it took 67 days. From the 100,000th case to the 200,000th case, this is worldwide, it took 11 days.
Oh, my.
And from the 200,000th case to the 300,000 case, it took 4 days.
My goodness.
So that's why social isolation and distancing is so important. And I'm going to be honest about this, and Mike and I've had this conversation, and I have to give credit to a lot of people who were had more foresight than I was thinking. You know, 6 weeks ago I thought that we're overdoing this a little bit, and I think the public health folks and the researchers have done a fantastic job of making recommendations. And even though this seems very draconian and harsh, this is slowing down the growth and transmission of the virus. It is an interesting virus in the sense that, unlike influenza, let me back up. It is a virus. Influenza is a virus. The coronavirus family, and Mike and I have talked about this a number of times, it's been around forever and will continue to be. This is a particular strain that has kind of morphed into another strain. And what we saw in China and Italy especially, up until recently, Italy had more deaths than anybody else. In fact, I think they probably still do. That particular genome, which was at the beginning, has morphed into one that is a little less virulent, meaning it kills less people, but it's still equally infected. Okay, and the group that tends to succumb to this are people, especially the elderly, and those with some immunosuppressive problems. Okay, the death rate in the elderly is 14.8%, and that's a staggering number. If we consider that yearly, the flu death rate is about 1%. So in the non-elderly, there was a report I read this morning from NYU that about 80% of people who get this virus, though, have very minimal symptoms. And that's kind of flu-like type symptoms. Now, you can feel pretty sick with the flu, but most people don't succumb to the flu. You go to bed, you hydrate, you take, particular medications, and you do okay. And so 80% of people with this really have very minor symptoms. Now, to answer your question, what do people succumb to is that viruses are not treated with antibiotics. Okay, historically they've not been. They don't respond to antibiotics. So there are some antiviral medications out there, but none of them seem to be very effective with this at this point. Now, there's research going on, as you can imagine, like crazy right now, and the same thing with vaccines. But people succumb to this because it causes inflammation in your body, which then causes swelling in the lungs, and usually people die of respiratory illness that you just have to support people through and not treat it. That was a long answer to your question.
No, that's what we done. You talked about symptoms, and I know we've covered this a little bit. So your symptoms of this would be, what do we need to look out for?
Unfortunately, your symptoms for this can be as minor as a common cold.
Yeah.
Coughing, aching, sore throat, that sort of thing. But, the sneezing, honestly, is really not a symptom, okay? Sneezing is more of an allergy symptom. And here we are, it's springtime, plants are blooming everywhere, and there's pollen. So, sneezing is not really considered part of the cohort of symptoms. It's really a cough, and it's pretty much of a dry cough. And then it's associated with fever. Fever is really important. Fever, of course, is your body beginning to mount its response. And so, generally, with a common cold, people don't have a fever. People do not have a fever with allergies. There's a term out there called cedar fever, and I believe it's real. However, allergies don't produce fever. And so that being said, having a fever typically will go up pretty high, in the 101 range or so, and then a lot of times the fever doesn't want to respond to typical measures. So continuous fever, coughing, achiness, those are kind of symptoms of coronavirus. As I said, there are also symptoms of other things that we see every year. Every year we see the flu, and then we see the, quote, other things. And so there are always other viruses that cause similar symptoms. They're typically not as bad. We usually support people with, Tylenol and ibuprofen and such, and symptom control measures like antihistamines and whatnot. But antibiotics are just a waste. And, I have had this question probably, 10 times. Well, don't I need to get on some antibiotics to prevent anything? Let me make this perfectly clear. Antibiotics don't prevent things.
They don't.
They don't.
Okay.
They don't prevent disease. They kill bacteria. That's what they do. Antibiotics kill bacteria. They focus on actually destroying that pathogen. We just don't have that for viruses.
Again, we're talking with Michael Cloy, Dr. Tom Byrd. Tons of people are watching on our Facebook. I think we've just set a record for Facebook viewers, by the way. A lot of people tuning in over there, and we appreciate that. So, at what point, if I feel some of these symptoms, should I call or do something? What do you suggest for anybody out there that might be running a little fever? And I think it's like 100.4 or something is the concern level or something like that.
Yeah, and some of that's changing very daily. In fact, the testing criteria that was laid out by the CDC since March the 3rd has changed 3 times. And I suspect there's going to be different criteria. In fact, Mike and I talked about this early in the week. I thought this week they would drop one of the recommendations with the travel. But right now, the criteria for testing someone is that you have shortness of breath and or cough and a documented fever or a subjective fever at home. Okay. And travel, contact with a patient known to have COVID. A second subgroup is those same symptoms and someone who has traveled to an endemic area where there have been increased cases. Then the third group is a patient that is in a healthcare system who has been ruled out of other viral symptoms, such as the flu or mycoplasma pneumonia, and has no answer to their questions and continued fever. Now, that seems cut and dry. Now, having said that, there's without question some increasing information that there are people that have not traveled to endemic areas, or epidemic areas, if you will, and are testing positive. So my strong feeling is the CDC will drop that criteria very soon if they haven't already, because I think this is becoming a community-based infection, just like the flu or the cold or anything else. The other thing that I think makes this a little tough, and any healthcare provider out there will verify this, and Mike and I have seen flu this week. We've seen mycoplasma, which is the old walking pneumonia, where it's treated, it is a bacteria, but it has similar symptoms. Plus there's other little viruses going around that you go, well, that's pretty suspicious. So the testing, the sands are shifting pretty quickly in terms of what we're able to do. I guess your original question though, Carl, was if you have symptoms, what should you do? Well, first of all, I think the thing to do for all of us is quarantine yourself. Before you even seek medical care, get the patients, or I'm sorry, the family members and cohorts away from you. Social distancing is 6 feet. Make sure people are staying away from you, and then call your healthcare provider and ask for an appointment or get their recommendations.
I think I'm going to piggyback off that and say I think that this is kind of in a way educating us on things that we should do every year,
Absolutely.
regardless of whether we have COVID. Because when your kid's sick at home and you got to go to work and you dose him up with some Tylenol and send him to school, bad parent. That we've all done it. I've done it. I'm not going to say I haven't. Because you got life to go through. But when you're sick, irrespective of COVID, most things are transmissible. That's another question I always get every day. Prior to this year, am I contagious? If you have a virus of any kind, you're pretty much going to be contagious. Now, so you distance yourself and you take care of yourself as you should with any other viral illness. So when you exhibit symptoms, like Dr. Byrd said, stay at home, give your doctor a call. If you're not overtly ill and struggling, you might be able to manage this thing at home. But if you're struggling, if you're having a hard time breathing, if you just cannot stop coughing, you probably are going to need to be seen.
Now, I know it's happened around the country. People have this virus. They don't know. People have succumbed to this because they didn't heed the symptoms and they didn't go see a doctor. Yeah, I know about this lady nurse in Georgia that's 42-year-old. I don't know if you've read about that or not. Interesting story on her. One of the concerns about this, of course, is I hear it spread so easily. And tell me exactly, talk about that a little bit, Dr. Byrd.
Yeah, well, I think there's two big concerns, and this has been known to some degree for probably a couple of weeks, but there was what we call a grand rounds at Stanford a week before last on a Wednesday, and they really kind of verified that probably 50% of people have this and don't know it. Okay,
Wow.
now that sounds terrifying,
Yeah.
but those folks don't shed the virus quite as much as someone who has symptoms. Okay, so they still have the capability to transmit the virus, but not nearly as much as someone who's symptomatic. That's why social isolation and social distancing is so important, to stay away from those folks, in the grocery line or whatever. You don't know. They're not exhibiting a symptom. So they're not quite as effective as the group that is truly symptomatic. The group that's symptomatic, it is transmitted by respiratory secretions. So sneezing, coughing, there is something somewhat magical about this 6-foot issue that the researchers and the epidemiologists have been saying from the beginning. So it is transmitted like any respiratory illness. Whether that's pneumococcal pneumonia or influenza, it's transmitted by cough, sneezing, and secretions, nasal secretions.
All right, facts and myths right here. I hear that it does, and I hear that it doesn't. Heat affecting this virus.
Most viruses are heat sensitive, not just this one,
Okay.
but most of them are. So that's probably a fact to some degree. As far as the degree of how much does it affect it, I don't know if anybody can give you the answer to that. I think what you're seeing in China is their cases have dropped, but there are multiple reasons. They've socially isolated big time. I mean, they've sequestered people, essentially lockdown, if you will, so that certainly helps. Their temperature, their climate is changing, so that's certainly going to help. And I think that definitely, I think that's a fact that heat will affect any virus.
Absolutely. Yeah, I was going to piggyback on that. Singapore, I think early on had the second or third most cases. Maybe South Korea was ahead of it, but after a week ago, their temperatures are now up in the 80s, and they're having very few reported new cases. So there's evidence, like all viruses, that heat affects it. But all viruses are unique, and I think we're very early on this in terms of how much compared to influenza or a rhinovirus or the cold type thing. How much does heat really affect it? But again, I think we can all think about this. Flu in the northern hemisphere is a winter illness that tends to fade out over time, and some of that has to do with transmission, but some of it has to do with temperature.
All right, ibuprofen, Advil, I've heard bad, not bad. What are your thoughts on that?
I say good.
You say good?
There was a, and I didn't read it, but there was a report, I would say, and I say you have to be careful with quote unquote studies or anecdotal information. That's why the blogs and so forth on the internet are somewhat dangerous. But you know, these NSAIDs, which stands for non-steroidal anti-inflammatory drugs, we use them to treat pain, we use them to treat fevers. As far as we can tell, there's no substance to the fact that if you take those, it's going to increase your risk of getting this disease.
All right. Now, a lot of people are saying this disease mainly affects older people, but that's not true. I read a fact that 38% of the cases in the United States are ages 20 to 58. So what do you say to that?
Absolutely. 56% of people, I just got this last night off the Texas Department of Health website. 56% of confirmed cases in Travis County, which is a young county. I mean, you're talking about Austin. 56% are young. Now I guess the silver lining of that, I'm sorry that those folks feel sick, but their mortality rate is minuscule compared to those over 70. There also seems to be, and again, it's been about 48 hours since I saw any updates on this, that the death rates seem to be a little higher on middle-age and older men, not 70, who smoke. And more than women for some reason, and there's some theoretical reasons behind that. But those are the two groups that seem to have the highest mortality rate. Now, like anything in statistics, there's going to be outliers. I mean, and you hear terrible stories of a child that died, or a young nurse or something like that who was not immunosuppressed. You know, that's the nature of infectious disease. But, you know, again, you know, when you deal with clinical medicine, you have to deal in cold, hard statistics, and the bulk of people that do succumb to this are elderly.
All right, tons of people are watching this, and they pose some good questions. Can I read a couple of these to you?
Sure.
I had one right here. Susan, if someone's been diagnosed with COVID, were quarantined, and now reaching the end of their quarantine, could they still be carriers of the virus?
That's
kind
a
of an
great
interesting question. Yes.
Yeah.
That's a great question. And the answer to a lot of these questions is probably going to be, I'm not sure, simply because this is such a novel issue, and I'm not a researcher, although I think Mike and I, and probably most healthcare providers in our community, are spending an inordinate amount of time late at night keeping up with breaking news, because it does change so quickly. I'll say this. The reason there's a 14-day quarantine on this is that on average, from the time of infection to the time of symptoms is 5.2 days. Okay, on average.
5.2.
5.2. Now, there have been cases that have been documented that was up in the high 11s, 11 days, 11.5, something like that. So that's why 14 days is now recommended. Now, as I said before, from the time this first started in Wuhan province in China until it's here and now in Europe, the gene has morphed into, the virus has morphed into kind of subcategories, if you will. So I think we're still sailing a little bit on uncharted seas, but I think in general, the 14-day rule, if you're asymptomatic for that time, you're good to get rid of self-quarantine, but by the same token, you still need to maintain some social distancing.
Yeah, especially even though let's just say you've contracted the virus and you're minorly ill, you've got a mild cough and that sort of thing, and at the end of the 2-week period, you're feeling better, you've basically recovered, but you still have a residual cough or something like that. You could possibly be shedding still. So anytime you're still exhibiting any symptoms, you definitely need to keep yourself safe. If you're asymptomatic the entire time, let's just say hypothetically you were tested for whatever reason, and you're asymptomatic the entire time, at the end of the 14-day period, if you're probably not shedding anything at that point.
Absolutely.
That's safe to say. I also think the reason I think 14 days also is kind of the magic number. You're going to build your antibodies by that time. And at that point in time, you're probably going to, if you were to be tested for antibodies, which is your host immune system, then you're probably fighting this thing off, and you've essentially eliminated it on your own, as you do with most viruses.
All right, gentlemen in the medical field, as being in the medical field, what would you say to people out there that to avoid maybe contracting this terrible virus? What's your best advice, Dr. Byrd?
Very simple, and really you don't have to necessarily be a medical person to say this. On the way in, I listened to the mayor. Do common sense things. You know, right now there's no question, as I said, kind of draconian as it seems, of locking people down and all that. You know, we're not to that stage, but treat it that way. You know, get outside and go for a walk. Stay 6 feet away from people. Again, not to make anybody paranoid, but because we do know there's a huge percentage of these people who are asymptomatic, you know, avoid big crowds. This idea of social distancing is absolutely effective. Now, that doesn't mean don't go to the grocery store. You know, if you need bananas, don't hoard toilet paper, though.
I knew it was going to come back. I know it was going to come up.
No one's quite figured this.
Bananas, don't hoard
No.
toilet paper.
That was comma or semicolon. Sorry about that. But no, go to the grocery store and stay 6 feet away from people, and don't shake hands.
Right.
If you cough into your elbow. Don't sneeze without. I think very basic things that we should be doing all the time anyway.
Sure.
Right.
And some of the things that I would have said 3 weeks ago, stay away from big crowds, well, that's kind of been taken care of. I mean,
well, one thing also I was thinking about, what's so hard for us, and I'll tell you right now, it's really hard for me. I'm a toucher. I like to shake hands. I like to hug people. It's just the way I am. And it's really difficult. We really shouldn't be doing that right now. Because, we're in healthcare. We're around sick people all day. We're wearing gloves. We're wearing masks. But still, we probably shouldn't be doing that right now. And it's just for our protection. I've had guys go, I don't care, I'm tough. And I am too. I think we are tough. And that's a Texan way of doing life. But for now, let's just don't do it. I also watched the mayor's video last night that he released about our current situation with the limited contact, stay-at-home thing. It just makes sense. It really does. That's the best way that we can protect ourselves and each other.
You mentioned the store. Now, all of our 3 major grocery stores are offering curbside pick. They will come to your car and load your stuff up for you. So keep that in mind too.
Fantastic idea. Yeah.
I think it's a great idea, and it keeps you out of the toilet paper aisle.
The other thing, just to piggyback on what Mike said, I had no idea this was the case, but when all this was coming about a month ago, there's some data out there that the average person touches their face 25 times an hour.
Oh my!
Yeah. So and
really?
Yeah. So you play with your chin or do that, and that's a good way to you've started the transmission from your airway to your hands, and then you're shaking hands, and so there's keep that in mind. It's such ingrained. Yeah, you've got your hands under your armpits.
I do. I'm going to stop.
Don't touch your face now. After you've had your hand under your armpit.
Okay. What do I do with my hands?
Sit on them.
Walk away.
The other thing is you get asked a lot of times, well, how long does the virus stay active on an inanimate surface?
Right.
Or what we call a fomite, or something that you pick up. That is also conflicting.
It is.
It also kind of depends on what you touch. Porous items like cardboard and things like that, it seems like they seem to hold it a little longer. You would think it would be something like stainless. It would slide off of stainless steel.
But it doesn't.
It seems to hold it longer.
Yeah.
And so that question is asked about a lot of diseases, and it's really hard to say.
And that's when somebody first brought up the gas pumps, I'm saying, but you know what? There's some logic to that.
There probably is, but I would say this, that a petroleum product like, who knows what, there's residual gas on your gas pump probably. What is that doing to the virus? I don't know.
Interesting. There's a lot about this virus we don't know yet.
Absolutely.
Sure.
Things change every day. Golly.
They do. Things change. But just like Tom said, Dr. Byrd said, and Mayor Haynes, I applaud him big time. It's a lot of common sense. It's some of this stuff is what we should be doing all the time. Not shaking hands, but protecting ourselves when we're ill.
The other thing I'd like to throw in really quickly is, there's always social anxiety, community anxiety, world anxiety about this. Absolutely justifiably so. But Mike and I were at an Excel function, and a guy of a completely different topic. He said, "All storms pass." Yesterday at our little prayer at lunch at Excel, or day before, was, weeping may endure for the night, but joy comes in the morning. This is going to pass. In 1917, influenza infected 500 million people in the world, and 50 million died, and we haven't seen that strain again. The other thing is, our researchers in this country are phenomenal. This will at some point have a vaccine if it continues to run its course. There'll be treatment options out there, and so this isn't the zombie apocalypse. It is very serious, and I do not want to downplay that one bit. The other thing I'd like to plug is I think locally, BRMC has done a phenomenal job. If this really turns into a significant issue locally, they're ready. The number of the availability of critical care has really been ramped up. They've made some changes, and I think also everybody, the local nursing homes, no visitors, the hospital, no visitors. That seems so harsh, but you can't let this get into the elderly community. And so, I know if you've got loved ones in a nursing home, it's tough. It's really tough.
As I do.
But if one patient catches it in there,
it's a wildfire.
It is.
All right. Well, gentlemen, this has been great. Tons of people watching on the video. It's going to be up too, so people can go back and watch. And man, I cannot thank you both enough for coming out here and sharing all this information. And maybe we can do this again
sure.
here in a couple of 3 weeks or so, if that's okay.
Sure. I think it's good to keep everybody on board and keep everybody apprised of what the latest information is. And it is also good to debunk some myths. I mean,
yes.
The internet's a dangerous place, man.
It is.
No
you
kidding.
gotta be careful out there.
All right, so there's a lot of questions people are asking on Facebook over here. We can't get to them all, but is there someplace people can go and get some of these questions answered? What do you suggest, or call, or what?
It's tough. I think I would recommend reputable medical-ish websites.
Okay.
The CDC and the World Health Organization do a fantastic job, and they're updating it all the time. The other thing is, there doesn't have to be any medals for bravery. If you feel bad, call your provider, call your practitioner, and let them make a decision if you need to be seen or not.
I agree, and I think calling is critical because if people just flood the clinics, the early clinic out there that's run by the hospital, fantastic group of providers out there. They're great. That place, I jokingly call it a battleground sometimes because they get overrun. You shouldn't overrun them. Really, call them first. If they can deal with some of your symptoms over the phone, we can deal with some of your symptoms over the phone. We're going to probably be starting some telehealth measures with video conferencing and such. And so I think calling first is important before you just show up. And they can give you some advice over the phone, but stay calm. That's the biggest thing.
I think along those lines, and I would say this about anything before this ever came, the word emergency room is for emergencies. And just showing up because and I'm not minimizing this, because you're nervous or worried to the emergency room puts you at higher risk because there's a higher volume of patients that may be sick from something else. So what I would do is get on a reputable website like the CDC. Or the World Health Organization. I really prefer CDC for a number of reasons. Right. But then call your practitioner and just get some advice.
Yeah, don't use Google, Dr. Google.
Okay.
I noticed that Google has when you start doing medical things now, Google goes into Dr. Google mode, which can be dangerous, or Wikipedia mode. But the CDC website, there's great information. It's easy to navigate. That's been one of my go-to things. A lot of it's just general information. Don't get all focused on the case counts and how they're different on the CDC than they are on Fox News. Case counts shouldn't matter to you.
Right.
Your own health and what they recommend, how to protect yourself and others is what should matter to you.
All right. And on that note, good advice. Michael Cloy, thank you, sir.
Appreciate
I've already had a lot of people asking you guys to come back and do this again. A lot of nice comments over there, and very informative. Dr. Tom Byrd, thank you as well. You guys stay safe.
Hey.
And we appreciate all of our medical professionals out there and what
Absolutely.
they're doing for
Well,
us.
my neighbor made me some homemade masks, and so I think that's pretty cool.
All right, that is cool. Michael Cloy, Dr. Tom Byrd, appreciate you gentlemen. We'll do it again sometime, and appreciate everybody watching over here on Facebook, and that'll be up. You can continue to see that. It's 8:43 on KOXE.
That was a long time without a commercial.
Man, that's all right.
Yeah, that was.
Oh, the Queen almost.
I don't want to do that.